Good afternoon, everyone. Today is Friday, May 19th. I'm Donna Will, Professional Development Coordinator for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to the DDA Waiver Renewals 2023 webinar. On the panel today, we have Bernie Simons, Deputy Secretary for the DDA, Rhonda Workman, Director of Federal Programs and Integrity, Nova Evans, Deputy Director of Federal Programs and Integrity, Nick Burton, Director of Programs, and Robert White, Director of Operations. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and by phone. If you look at the interface on your right labeled audio, you can click either computer or phone to switch for the best option. We will be recording the webinar and posting this session on YouTube and the DDA website. Today's PowerPoint has also been uploaded as an attachment and is available for you to download in the webinar panel box. If you are listening by phone, you can request that it be emailed. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Rhonda Workman. Hi, Rhonda.
Hi, Donna. Thank you. And thank you for joining us today as we share information related to the 2023 DDA Medicaid waiver renewals. Today, we will begin by sharing a brief overview of our programs we operate on behalf of Maryland Medicaid. All federal Medicaid waiver program applications include details related to the services, which is noted in the application section Appendix C, titled Participant Services. Appendix C lists all the waiver services and includes details related to the service description, service requirements, limitations, service delivery models, meaning whether the service can be self-directed or is provided under the traditional service model, and provider types and qualification requirements. We will be sharing today some of the changes associated with the service descriptions, requirements, limits, provider qualifications, and whether a relative, legally responsible person, or legal guardian can provide the services. Additional updates were made in the renewal applications related to reserved slots and language to better clarify the services that you can view on our dedicated renewal web pages in our track change documents. It's important to note that all of the renewal changes go into effect on July 1st, 2023. We have updated existing policies to reflect the renewal changes that can also be viewed in Policy Stat. We want to encourage people and teams to begin to explore the new options and flexibilities that we'll be talking about today. They can be incorporated now in person-centered plans that become effective July 1st, both for current participants enrolled and also new participants enrolling, such as our transitioning youth. For more detailed information, please refer to our waiver applications, our regs, policy, and guidance. In addition, today we will be sharing information and links to new and updated DDA tools, guidance, and manuals that also reflect the renewal changes. This includes a new guide to service for people and families, and an easy read version of the guide, and updates to the guidelines for service authorization and provider billing documentation. The DDA staff are always available to provide assistance and answer questions related to the renewal or other topics. Next slide, please. Now we're just going to do a brief overview of the waiver programs that the DDA operates. Next slide, please. The DDA operates 3 Medicaid waiver programs on behalf of the department. A Medicaid waiver is a federal medical assistance, also known as Medicaid, program. Waiver means that some of the regular Medicaid rules are waived That means they're not applied. Waivers are typically intended to give states flexibility to serve specific populations and provide services in innovative ways. Waiver programs are approved for a 5-year period and then must be renewed. The department recently received approval from the Federal Center for Medicare and Medicaid Services, also known as CMS, for the DDA's 2023 renewal applications. The DDA waivers include the Family Supports Waiver, Community Supports Waiver, and Community Pathways Waiver. The waivers have over 40 services and support options, and we break our service and support options down into 3 major areas we refer to as buckets, which include meaningful day services, support services, and residential services. Next slide, please. This slide notes the meaningful day services. You'll see that these services are provided under our Community Supports and Community Pathways waiver. Next slide. This slide includes the various standalone support services and the programs for which they are available. Most are provided in all 3 waiver programs, as noted with the checks. Next slide, please. And this slide includes the residential services that are provided only in the Community Pathways waiver. Now, I would like to introduce Nova Evans, my Deputy Director, to share service-specific renewal updates. Next slide, please.
Excuse me. Thank you, Rhonda, and good afternoon, everyone. I'm going to be just going over the updates, highlights for each of the services and the changes that it will be coming on July 1st. So next slide. So this slide shows the main update related to assistive technology and services. The threshold for requiring an assistive technology assessment is being increased from $1,000 to $2,500. So that means if a person needs assistive technology costing more than $2,500, an assessment is required. Please note anyone can request assistive technology assessment no matter what the cost. So at the bottom, we have included a link to the approved Community Pathways waiver renewal and reference the page number, and that will be on each slide. So next slide, please. Okay, so this slide shows the main update related to behavioral support services. So service updates include the behavioral assessment includes review of the person's communication skills and how challenges with communication may relate to behavior. The development of a behavior support plan, if applicable, must include goals that are specific, measurable, attainable, relevant, time-based, and based on a person-centered approach. Behavioral consultation includes ongoing review of needs and challenges in all appropriate environments. And for provider qualifications, we're also updated to note that providers of behavioral assessment and consultation services have training and experience in analysis of different styles of communication and communication challenges related to behavior, ethical considerations related to behavior and psychological services, and positive behavioral supports and trauma-informed care. Next slide, please. So this slide shows the main updates related to community development services, and these are related to authorization of dedicated one-to-one or two-to-one supports. So the DDA will authorize these levels of support when a person has a behavioral support plan noting specific behavior, unless otherwise authorized by the DDA, or a nursing care plan noting specific health and safety needs, unless authorized by the DDA. The DDA may authorize dedicated supports for people new to services, including transitioning youth, and people in services who have a new specific behavioral or health and safety need, while a behavior support plan or nursing care plan gets authorized and developed. In addition, the health risk screening tool, or HRST, can be used to assess a person's health and safety needs. Additional updates related to self-directed services staff include reimbursement, to note that the option to cover costs associated with training, mileage benefits, leave time, and mileage reimbursement, and that these costs are allocated from the participant's total budget allocation. The renewal also include removing the requirement for the direct care professional to have a high school diploma or a GED. Next slide, please. So this slide shows the main updates related to community living enhanced supports, related to the authorization of dedicated one-to-one and two-to-one supports. So again, the DDA will authorize these levels of supports when a person has a behavioral support plan or a nursing care plan, noting either a behavioral need or a specific health and safety need, unless authorized by the DDA otherwise. And the same thing applies here. The DDA may authorize dedicated supports for people new to services or with new needs, while the behavior support plan or nursing care plan gets authorized and developed, and may also use the HRST to assess a person's health and safety needs. Next slide, please. So this slide shows the main updates related to community living group home supports. Again, related to the authorization of dedicated one-to-one and two-to-one supports. So the same thing applies here. A behavioral health support plan, nursing care plan would be required unless otherwise authorized by the DDA. The renewal also included removing the requirement for direct care staff to have a high school diploma or pass a GED for a community living group home. Next slide, please. Okay, so this slide shows the main updates related to day habilitation. And again, the use of the authorization of dedicated one-to-one and two-to-one supports applies here as well. So the DDA will authorize these levels of supports if the person has a BSP or a nursing care plan. It's the same requirements, of course, unless otherwise authorized by the DDA. And this renewal also includes options for services to be provided any day of the week for day habilitation. Next slide, please. So this slide shows the main updates related to employment, discovery, and customization. The update notes that the services may not exceed a maximum of 40 hours a week, including in combination with any of the following other waiver program services in a single day, meaning supported employment, career exploration, community development services, and day habilitation services. Next slide, please. So this, this slide shows the main updates related to employment services. They include clarifying job development and ongoing job supports are built in 15-minute increments. We removed the 10-hour per day limit for ongoing job supports to support people working overtime, and expand the opportunity for a legal guardian or legally responsible person to be paid to provide this service. And this is in addition to the options for a relative who is not a spouse to be able to provide that service. The renewal also included noting staff requirements to meet employment credentials, licenses, and certification requirements as noted in the DDA's meaningful day policies. And we removed the requirement for direct care professionals to have a high school diploma or GED. And always please refer to the approved waivers and DDA's policies for additional requirements when hiring a relative, legal guardian, or legally responsible individual. Next slide, please. So this slide shows the main update related to environmental modifications. The maximum amount of environmental modifications is increased from $15,000 to $50,000 every 3 years, unless authorized by the DDA. So please, again, be sure to see the approved waivers and details about modifications that are not included, and included the requirements for environmental assessments. Next slide, please. This slide shows the updates related to housing support services. The service has been expanded to include assistance with bill paying services, For example, assistance with setting up and monitoring systems to pay rent, mortgage, utilities, and other related housing expenses. In addition, we clarified that housing assistance staff have training related to creating personal budgets with people with developmental disabilities. Next slide, please. So this slide shows the updates related to individual and family-directed goods and services. It's often referred to as IFDGS. This service is one of the services that had the most significant updates. It's also only available under the self-directed service delivery model. And the updates to the services were associated with the Self-Directed Services Act of 2022. So updates include expanded items, activities, and services covered, and services not covered that we're going to be reviewing on the next few slides. It includes requirements and criteria to access individual and family goods and services, and the removal of the limit with items in excess over $5,000 requiring DDA review. Next slide, please. So this slide shows added items and activities. Please refer to the waiver for an entire list of all items and activities, but these were the ones that were added to the waiver. So these include, but are not limited to, activities that promote fitness. For example, fitness membership, personal training, aquatics, and horseback riding. Fees for promoting and activities that promote socialization and independence, such as art, music, dance, or sports. Small kitchen appliances that promote independent meal prep. Examples are air fryers, microwave, toasters, ovens. Laundry appliances to promote independence and self-care, such as a washer or dryer. Sensory items related to the person's disability, for example, headphones or weighted vests or blankets. Safety equipment related to the person's disability and not covered by health insurance. So example may be protective headgear or arm guards. Personal electronic devices, including watches and tablets, to meet an assessed communication or behavioral purpose, which is documented in the person-centered plan. Day-to-day administrative supports, which include assistance with all aspects of household and personal management, essential to maintain community living, including support with scheduling and maintaining appointments and money management, and internet services. Next slide, please. And this slide shows new additions to the waiver for items and activities that are not covered. Some of these are clarifications. So it shows that items are not covered are included but not limited to services, goods, or supports provided to or directly benefiting persons other than the person that have no benefit to the person. Items used solely for entertainment or recreational purposes, such as televisions, video games, game stations, DVD players, except when they're needed to meet an assessed behavioral or sensory need, which is documented in a behavior support plan. Travel adventures, personal clothing and shoes, haircuts, nail services and spa treatments, exercise rooms, swimming pools and hot tubs, fines, debts, legal fees or advocacy fees, contributions to ABLE accounts or similar savings accounts, country club membership or dues, leased or purchased vehicles, and items purchased prior to an approved person-centered plan. And again, this is not a complete list of exclusions, but please see the waiver and DDA guidance for additional information. Next slide. And this slide shows criteria associated with getting individual and family-directed goods and services. So in order to access the services, the item must relate to a need or goal in the person's PCP, maintain or increase their independence, promote opportunities for community living, integration, and inclusion. It does not compromise the person's health and safety, and it is provided to or directly exclusive to the benefit of the person. Next slide, please. This slide shows updates related to the requirements associated with individual family-directed goods and services, including that items, services, and goods must decrease the need for other Medicaid services, or promote inclusion in the community, or increase the person's safety in their home, and the person does not have the funds or to purchase the item or service, and it is not available through another source. And Christy Kubrath, the DDA statewide coordinator of self-directed services, will be sharing more information about individual family goods and service requirements and other self-directed services on Monday during the Self-Directed Services Updates webinar. Next slide, please. This slide shows updates related to live-in caregiver services. And the update here is who can provide this service. We clarified that siblings can provide this service. Next slide, please. So this slide shows the updates related to nursing support services. Service changes included the addition of self-directed services, employee options to provide training, benefits, and other reimbursements. Service limits, previously noted under the standalone nursing services, were included to note nurse consultation services up to a 4-hour period within 3-month period, nurse health case management services up to a 4-hour period within a 3-month period, nurse delegation every 45 days or more frequently based on the nurse's judgment. And nurses are required to attend all DDA provided nursing meetings. Previously, the requirement was to provide 2 quarterly meetings per fiscal year, but please note if a training is a requirement, it will be noted on the training announcement. Next slide, please. So this slide shows the updates related to participant education, training, and advocacy supports. So we've expanded the opportunity for a relative, legal guardian, or legally responsible person to be paid for this service. And again, please refer to the approved waivers and DDA's policies for additional requirements when hiring a relative, legal guardian, or legally responsible person. Next slide, please. This slide shows the updates related to personal supports. Included language to note that personal supports include overnight supports. The DDA will authorize an enhanced rate dedicated 2-to-1 supports or overnight supports when a person has a behavioral support plan noting specific behavior, unless otherwise authorized by the DDA, a nursing care plan noting specific health and safety needs, unless otherwise authorized by the DDA. And the DDA may authorize dedicated, enhanced, or overnight support for people new to services, including transitional youth, or people already in services who have a new specific behavioral health or safety need while a BSP or a nursing care plan is getting developed and authorized. Again, in addition, the HRST can also be used to assess a person's health and safety needs. We clarify that overnight supervision support must be specifically documented within the PCP. And this includes information that details the need for overnight supports, including alternatives explored, such as the use of assistive technology and other strategies. In terms of service limits, under the traditional service delivery model, the DDA may authorize up to 82 hours per week of supports unless otherwise authorized. And the renewal also included removing the requirement for the direct care professional to have a high school diploma or a GED for personal supports. Next slide, please. This slide shows the updates related to remote support services. And the update clarifies that remote support services do not need an electronic audiovisual conferencing software application that are reliant on the participant to maintain the connection. So this means that the remote support services provider is responsible for providing the system and ensuring connectivity. Next slide, please. This slide shows the main updates related to respite care services. They include the option to use respite care as an emergency backup plan. It includes that services are billed in 15-minute increments at a daily rate and camp fees. And the renewal added the opportunity for organized healthcare delivery system providers to also provide the service. And we expanded the opportunity for a relative, legal guardian, or legally responsible person to be paid to provide the service. And again, please refer to the waiver for additional information. Next slide, please. Okay, so this slide shows the main updates for shared living services, and they include updates associated with the different service levels. We added for level 2, the person may participate in meaningful day services or have a job. Level 3, various reasons a person may have this level of support and not all conditions need to be present. And under the self-directed service model, we added the option for budget authority. The renewal included removing the requirements for direct care staff to have a high school diploma or GED. And in addition, for shared living, siblings may also provide this service. Next slide, please. Okay. So this slide shows the updates related to support broker services. This service is the other service with the most significant updates. The service updates were associated with the Self-Directed Service Act of 2022, and this service is only available under the self-directed service delivery model. So here we can see that updates include the expanded role of the support broker, which aligns with the Self-Directed Services Act of 2022. The service is now required if a relative, legal responsible person or representative payee and guardian service paid staff. It is an optional service otherwise. Funding associated is for initial orientation and assistance of up to 15 hours. Support broker services up to 4 hours per month and up to 30 additional hours as needed can be purchased within the person's total approved annual budget with unallocated funds. The renewal also includes removing the requirement for the direct care staff to have a high school diploma or GED. A support broker must be certified by the DDA and demonstrate core competencies. And we expanded the ability for a legal guardian or a legally responsible person to be paid to provide this service. This is in addition to the options for a relative to provide the service. Next slide, please. So the support broker expanded role. So support brokers can assist the participant along with their team or designated representative with various tasks associated with self-direction. The renewals include additional language related to the support broker services, including but not limited to defining goals, needs, and preferences, making informed decisions in arranging, directing, and managing services, including personnel requirements and resources needed, development of an emergency backup plan, identifying, accessing, and managing supports, services, and resources, independent advocacy to assist in filing grievances and complaints, and understanding the responsibilities involved in self-direction, and all duties for which the support broker will provide assistance is based on the person's preference and choices and should be noted on the support broker job description for employees hired or the support broker service agreement for vendors hired and the participant agreement form as applicable. And again, just to note that there will be a self-directed services update webinar on Monday where we'll share more information related to the waiver renewal. Next slide, please. So this slide shows the main updates related to supported employment. So the waiver renewal included here, removing the requirement for a direct care professional to have a high school diploma or GED. Next slide, please. Okay, so this slide shows the main updates related to supported living supports. related to the authorization of dedicated 1-to-1 and 2 supports. So again, the DDA will authorize these enhanced supports if a person has a behavior support plan or nursing care plan, noting specific behavioral health need, health and safety need, unless otherwise authorized by the DDA. Again, the DDA may authorize dedicated supports for people new to services or already in services, while a behavior support plan or nursing care plan is being authorized and developed. You can also use the HRST to assess a person's health and safety needs for this reason. And the renewal also included removing the requirement for direct care professionals to have a high school diploma or GED for supported living. Okay, next slide, please. This slide shows the main updates related to standalone transportation support services, including that transportation funding authorization up to $7,500 per year per participant. Commercial providers like Uber and Lyft may provide this service and are not required to complete pre- and service training. We removed the requirement for the direct care professional to have a high school diploma or GED for transportation services, and expanded the opportunity for a relative, legal guardian, or legally responsible person to be paid to provide this service. Again, please refer to the approved waivers for DDA's policies in regard to that. And so now I'm going to turn it back over to Rhonda. Next slide.
Thank you, Nova, for walking us through some of the main updates to the waivers. Today, we are also happy to share information related to updates made to various DDA tools, guidance, and manuals reflecting the renewal changes. Next slide, please. So this first slide is a visual of our new guide to services for people with intellectual and developmental disabilities and families. We've got a link there that you can click on. We have posted it to the DDA website on our person-centered planning page. You can see from the table of contents that it includes a lot of information related to DDA, including who we are, eligibility application process, including the waiver application process, access in terms of our priority categories. We also mentioned transitioning youth, the person-centered planning process. We touch on the DDA services, and we also provide additional resources. Again, this information is available on our website, and you can click on the link to access it. We want to thank the DD Council and the stakeholders who worked with us to create this over the last year or so, and really appreciate it and hope that you find it to be a useful tool. Next slide, please. In addition to that guide to services, it was recommended that we create an easy to understand shorter version of the guide. And so we've also are sharing today and have posted on our website the DDA's easy to understand guide to services. So it's a little bit shorter, a little bit more plain language. You can see an example there, and we've included a link to the website that you can directly access it. Next slide, please. In addition, in the recent DDA Connections, information was shared about the updated DDA Person-Centered Planning Manual. So here's a link to it and some information related to the table of contents. So another helpful tool that you can look at related to that PCP development and authorization. Next slide, please. In addition, we've updated the guidelines for service authorization and provider billing documentation with the renewal changes. You'll see that the existing one is still there, and the new one will have the reference to the effective date, July 1st, 2023. We've also included a link here, and it is also posted on the DDA Person-Centered Planning webpage. Now I'm going to turn it over to Nick to share some additional updates and clarification related to some recent information shared. Next slide, please.
Hey everybody, so gosh, a couple of weeks now we shared the meaningful day minimum hours table. And there's a few things that I want to just clarify on that so that it's super clear. I got good feedback that the table was generally fairly clear, but there are a couple things that I want to just remind people about. So in-person PCP meetings to make any of these meaningful day updates. People keep asking, are they required? No. No, no, no. In-person PCP meetings regarding meaningful day minimum hours are not required. You can do that via text, you can do it via email, via video with the team, have a quick conversation, talk about what you'd like to add it, and then move it through. Remember, in general, PCP meetings, a person's annual PCP meeting, a revised PCP meeting does not have to be in person. It is at the discretion of the person. The person decides if they want to meet in person or not for their PCP meeting. That's in multiple forms of our guidance, so please just remember that. It's the person who makes that decision. Just as an FYI, if nothing else is being revised in that plan and all you're updating is the minimum hours, it should be a pretty quick turnaround for approval within the regional offices. Regional offices agree, that should be quick. There shouldn't be too much to review. What's the reason below the minimum? What's the team doing to get the person back up to the minimum? And then for less than 6 hours, I think one thing we just want to be careful too is, listen, life happens. People have doctor's appointments, people get sick, people have family come visit and may not attend their meaningful day. That's fine, right? You don't need to account for every single one of those situations when you're talking about being below the minimum hours. If the person is generally speaking at 6 hours, right, and that happens relatively consistently, then great. So then you're fine. You don't need to account for every single time the person goes to the doctor as being less than 6 hours, and then what you're going to do to make sure the person doesn't go to their doctor's appointment. No, life happens, let life happen. We'll make sure that gets updated in policy, and I'm going to also make sure that gets updated on the chart. So I will update the chart with all this information, and then I will reissue the chart. All right, next slide. Okay, the SIP, Service Implementation Plan. I think it's had a couple names, but its current name is the SIP. A few things to help make things a little easier and to help facilitate more flexibility, to help facilitate plans moving around the process a little bit quicker. We've made some updates. So beginning July 1st, 2023, one SIP per agency for all goals. You do not need a separate SIP for all goals that your agency is supporting a person with. We are going to create a table that has the outcome identified in the plan, the service you're providing, and the goal, the implementation guidelines. It'll all be in one table. It'll all be fillable for there. You won't have to have multiple for all goals. Starting July 1st, the SIP is not required for self-directed participants. Reason being is there should be job descriptions in place, best practice. We want to see people have job descriptions, but there's also a participant agreement in place. So they are not required for self-directed participants. Starting July 1st, the regions will only review the SIP to ensure that it is 1, present, and 2, complete. Why? The SIP is a provider form. It is a form for you to make sure that your DSPs have the information they need to implement a goal for the person. Additionally, the proof is really in the pudding here, right, when it comes to progression on goals for people. OHCQ takes a look at that, the QIO, Liberty takes a look at that, and also the CCS, when they're monitoring, are taking a look to ensure that there is progress being made on goals. The regions, again, will only review that the SIP is present and that it is complete. We're also a technology first state, right? And so many of you have IT platforms. That's wonderful. We are going to allow you to recreate this document, the new SIP, once it becomes available, in your system. It has to have all of the same information, but as long as it has the same information and DDA approves it, you can use a document from your IT platform and do not have to use DDA's SIP form. In terms of DDA approval, we will give you some guidance in the next few weeks about what that will look like and who it needs to be turned into. We are going to update the SIP to reflect all of this information, but also we're going to be adding directions, examples, and a key, and then again, the table for all the goals. I am going to work and will be working with many of you who have brought forward recommendations, suggestions, ideas. So we will have a new SIP form by July 1st. So that is just an FYI for everybody on the call. Next slide. And, you know, I thought that might not be enough for flexibilities and to, you know, join in on all the July 1st fun. So starting with PCP's effective date of July 1st, if you are billing in LTSS Maryland, a DSAT is no longer required. If you are billing in PCIS2, you still need to turn in a DSAT to the regional office through the PCP process. Please note, if teams find that the DSAT is a helpful tool, you can absolutely use it. We're not going to say no, we're not removing it, we're not taking it away. If you find it to be a useful tool, please use it. The regions will just not reviewing it, they won't be looking for it. That's where good communication, good teamwork, and good person-centered planning comes into play. Providers need to make sure that when you're accepting a service, the information is correct. That will affect your billing, right? CCS providers, y'all need to make sure you're in really good communication about MA numbers, about addresses, about services, and making sure that that process is being driven by the person and that there is a good team conversation about what the person's requesting in terms of their service delivery. We will make sure that if there's any updates to the DSAT that they're made, and we will release that as soon as possible. Next slide. I think this is still me, so I'll just go with it. So just as an FYI, on Monday, May 22nd, from noon to 1:30, there will be a self-directed services updates webinar. Great stuff, great information, going into a little bit more detail on the stuff we talked about today. Also taking a look at the updates to the budget sheet. So please do not miss that if you are in the self-direction world, or if you're interested in the self-direction world. I would encourage you to attend that. Christie's has a real good time for y'all. Next slide. All right, I just wanted to give everyone a heads up that we are still on track, and our goal is to make sure that training matrices are available by June so that you can implement by July. The DSP one, we're taking kind of a deeper dive on just to make sure that we have all of our T's and I's crossed and dotted. So we will continue to communicate about that one, but we are finalizing the CCS information. We got really fantastic feedback on the CCS and frankly the DSP, and we're finalizing the CCS right now, so that should be good to go absolutely by June 1. Again, DSP, our plan, we'd love to get it out by June 1, but we're just taking a look at some things, and if anything changes with that, we will let folks know. All right, next slide. And I'm going to pass it over to Rhonda Nova again.
Yep, thanks, Nick. Thanks for all those great updates. So this slide is our regional office contacts. A few people may have person-specific questions or region-specific questions. Please reach out to the regional office director. They're here to help and support you. Next slide, please. And here are DDA headquarters office contacts. Myself, Nick, Christy, who's doing the webinar on Friday. I'm sorry, on Tuesday, Nicolette, if it's related to coordination of community services, and Leslie, related to provider relations and provider services. Next slide, please. And now we've got a number of questions. And Nick, since you were talking about the meaningful day, we did get a number of them in. So why don't we start with those, and then we'll go to the top. So a couple of questions when you were talking about the 6 hours. One question was, what if a person does not want to build up to 6 hours schedule and wants to continue with a 4 or 5 hour schedule?
Yeah, so that should be documented. The team should have a conversation about that. It should be documented in the plan. They're still below that minimum hours. So you're going to want to make sure that the plan's reflective of that.
Thanks, Nick. And then there was another question that says, what if the provider needs more time to incorporate adjustments into the PCP and can't get them done by June 30th? Can they submit a PCP similar to the current one and then add adjustments after July 1st via plan modification?
Yeah, so the requirement was that they be by July 1. So teams need to be having those conversations. They need to be having those conversations and discussing what that looks like. In regards to what that evolves into, right? There may be ever evolving plans, processes, things that the provider is going to do to help the person build back up to 6 hours, or maybe the team wants to continue to have more conversations. But initially, if a person's below the 6 hours, what's the reason for that? The team can then have a conversation about maybe putting into the PCP that we're going to continue to have conversations about A, B, C, D in order to make sure that we can get to a good place and that the person feels supported, and we will revise the plan as necessary at that point in time. But there does need to be some work that the teams are doing now to make sure that by July, that information is in a plans.
Great. And Nick, you were sharing with us that life happens and to let life happen, right? One of the questions was, does the change in length of day service mean that a person can go to a doctor's appointment and still be able to return to day services if they won't be there for a minimum number of hours?
Yeah, I think I probably would send me the information of who was sent that. I'd like to have a conversation about what that specifically means. We want to be flexible with people. We understand that people have doctor's appointments, so I'm not quite sure what the question's asking, but we can talk offline if you want to send me an email, or I can reach out to you as well.
Great. And then the last one, Nick, related to the meaningful day minimum hours. This one says, just wanted clarification because the end of Appendix K stated 4 hours minimum. Today we are hearing 6 hours. Please clarify.
Yeah, Comar has expressed shared 6 hours, which we linked to the Comar link in the table that we sent out 2 or 3 weeks ago that had the 6 hour requirement. So please take a look at the table that we sent out, and please take a look at the Comar requirements. Those have been in place since the last time we updated those, which are reflected in Comar. So this conversation has been socialized. We're just reiterating and making sure that it's clear.
Great, thanks, Nick.
No problem.
So Nova, going back to the top of our questions, the first one was about the removal of the limit to employment services ongoing job support. So we removed the 10-hour limit. Can you explain what that means?
So again, thinking about flexibility for people, we basically just removed it so that people could work overtime, or if their schedule wasn't 9 to 5, it was more flexible for people. So that is removed.
Great, thanks. So we had a question about the service updates related to behavior plans. And so a couple documents we shared, which was the renewal service summary chart, and some updates today related to other things for the behavioral assessment and such. Please note, if you're requesting initial behavior support services, you can request and be authorized for that behavioral assessment and behavioral plan, consultation and brief support implementation services to meet those needs. For annual updates to that behavioral plan, that can be done under the behavioral consultation service, because there's going to be ongoing assessments and review, looking at data, and then making updates and adjustments to the behavior plan. So those behavior plans wouldn't be authorized annually. If for some reason there needed to be an additional behavior plan authorized, that could be considered. But those could be all authorized for people initially going to behavioral support services, and then ongoing, the behavior plan would be conducted under behavioral consultation. Nick, can you help us explain again about dedicated 2-to-1 and 1-to-1 supports? The question is, does the HRST score have to be a certain level? Can you talk to us about the removal of the HRST score requirements for those dedicated authorizations?
Yeah, so traditionally, if I remember correctly, the HRST had to be a 3 or higher, and then it had to be in a behavior support plan or a nursing care plan. And an HRST, if there's not the threshold of having a 3 or higher, the HRST is a good tool for the team to utilize as they're thinking about one-on-one, two-on-one needs or other support needs. Really, where there should be good documentation of a person's needs is their person-centered plan and what that support looks like that may then require the request for one-on-one or two-on-one support needs. But there does not have to be a threshold of 3 or higher on the HRST.
Thanks, Nick. And as Nova was sharing with us today, and some of the information we've been sharing, a behavior plan or nursing care plan are good indicators and documents to help share those assessed needs, but it's not the only documents or options. The DDA can approve dedicated supports even without a nursing care plan or behavior plan. So it's really use that person-centered planning process to make sure we're outlining people's needs that could be noted in various documents. So going on to the next one, there's a question here, Nick, related to assistive technology. And as assistive technology state and the great services and options within the waiver that are available, this question relates to self-direction and being able to tap into assistive technology to support employer authority responsibilities. Would you like to add anything to that?
Yeah, I would just say assistive technology can and should be utilized for people to be more independent, to engage more in their community, to support them in directing their own lives. So if it's related to that, I would say you should start having a conversation with the team about assistive technology.
Thanks, Nick. Nova, we've got a question related to the information we shared about environmental modifications. We noted that the maximum amount for environmental modification was increased from $15,000 to $50,000 every 3 years. The question is, would this apply to vehicle modifications?
No, vehicle modifications is a separate service, so that limit was not updated.
Great, thank you. We had a question related to who to contact regarding self-direction. The DDA regional offices have self-directed lead staff that can help and assist you. Your coordinator of community services can assist you. In addition to Christy Colbreth, who will be sharing that information Monday related to self-directed service updates. We do have a number of questions related to self-directed services. Some related to the goods and services, some related to internet services and what that all implies, hotspots and other things. Those items will be shared with Christy so that she can address them in the webinar on Monday related to the self-direction. Okay, going down. So we noted Nova in the goods and services that the services should be provided to support the participant, right, directly and benefit the person. They were a little unclear on our terms when we said provided to or directly exclusive to the benefit of the person. Can you explain what that means?
Sure. Well, in relation to the Self-Directed Services Act, we just wanted to clarify that language, that whatever the activities, services, items are going to the benefit of the person, that should be documented in their PCP, what their needs and goals are, and that it's not meant for, staff-related services, or, it's really meeting that person where they are in their vision of a good life, and being able to get that directly to them.
Thank you.
Rhonda, can I add to that?
Sure.
Yeah, I think, the words get put in there, but I think the take home message is that applies to every person, right? That DDA provides supports to, or that we're all collectively supporting, is all of the work, the supports, the engagement is all related back to what a person needs and how to help the person continue to live their best life. So I think whenever we see that, that's just always the case. It should always relate back to the person.
Thank you, Nick. We have a question about the individual and family directed goods and services and whether it will be added to the PCP service authorization. So please note in the PCP service authorization, the staff recruitment dedicated funding of $500 for staff recruitment and retention is noted in the PCP detailed service authorization. But all other goods and services would not be reflected in the PCP service authorization section. It would be reflected on the budget. And Christy has some new and additional information she will be sharing with you Monday related to the process and tools to use. Nick, we had a question about, can nursing be billed for on-call services?
In terms of nursing services, we'd have to go back, and I would encourage the team to go back and look at the policy and the guidance that we've issued. There's clear guidelines on what nurses provide, when they provide it, how they provide it, and certainly based upon the person's needs and based upon what is outlined in the person-centered plan, and if applicable, what's outlined in the nursing care plan. So there certainly are times where somebody may call their nurse. I think it's also important to know and for people to keep in mind that, people do have primary care doctors. They do have access to the call-in centers at their local doctors or their local healthcare facilities. So there's a variety of options out there, but it certainly is a team conversation based upon what the need is.
Thank you, Nick. Nova, we talked about personal support services being limited to 82 hours for traditional services unless otherwise authorized by the DDA. So we've got a couple questions in here related to, for self-direction, can they go above those 82 hours? Can you share a little bit about that and why that change was made?
I might lean on you a little bit. I think what we're trying to say is that there is an 82-hour limit. There's a line that we say a lot, unless otherwise authorized by the DDA, and that's I think in there because every person is different and all the circumstances are very unique. So in that case, you know, if otherwise authorized means that if a person requires more services and there's an assessed need for that, there's flexibility there. And we don't want to stop the ability of someone to get the services. But I think that's kind of the line because it is unique to every person. And I'm not sure if I answered that question, Rhonda, if there's something you'd like to add.
Yep, absolutely. And as Nick has been sharing and reminding us, really use that person-centered planning process to look at people's needs and tell that story so that we could look at that. The SDS Act of 2022 notes that there couldn't be a limit set on that. So we removed that language, but again, the information demonstrating the supports that are needed, whether you're in traditional or self-directed, would be done through that person-centered planning process so we can authorize those services. Then we've got some questions about overnight supports for personal supports and enhanced supports. And I just want to remind everybody that we do have a personal supports policy and policy stat. You can access all our policies by going to the DDA website. At the top banner, there will be a section called Policy Stat. And under our personal supports policy, we talk about overnight supports. And overnight supports can include awake staff, and it can also include supervision during the night. And that's where it's important to have that discussion with the team to make sure, what's the person's exact needs that are related to those overnight supports, and developing those strategies, those service implementation plans or job descriptions if you're self-directing to reflect those needs. Going down to additional ones, we had a question about MD Think. We are not sharing information related to that today, but we'll continue to have information in the DDA Connections newsletter and additional information. So if you have specific questions, please reach out to the regional office and we're happy to help you with that. Nova, the question about a rep payee and whether they can be the person's support broker. Can you again remind us related to the flexibilities for relatives, legally responsible persons, and legal guardians?
Sure. If a person is a legal guardian, legal responsible person, relative, or rep payee is working for a person, a support broker is required. I think that's what you're referring to have quality oversight and to make sure that the person's being considered in that. A support broker is otherwise a optional service.
Great, thank you. We have a question regarding transportation services, Uber and Lyft. And then I think there's a variety of things in this question, but can you remind us some of the flexibilities of transportation in terms of the services available under the standalone transportation and options that can be used, including the use of relatives to provide that support?
Yeah, so I mean, transportation is a really important service, and I know that we have been really intentional about being flexible about how people use transportation within the service, outside the service, natural supports. We want people to be as independent as possible, which is why we mentioned specifically Uber and Lyft, because they are really good ways to get around and have people be independent in their lives and in their communities. One of the concerns was that transportation drivers like Uber and Lyft aren't really able to be trained. So we took out that requirement for DDA training for Uber and Lyft drivers because it wasn't really realistic for people to get around that way.
Yep.
So I think all that is to say is that we, there are many, many options of ways people can access transportation, and they should all be considered in light of what the person is able to do and where they want to go and where they want to be. So I think maybe some of that was included. Did I answer that question, or was there more?
Yep, no, I think that's true. It's just there's a lot of flexibilities within it. There's a lot of options in who can provide the service. Relatives can, and they can be reimbursed. So that information is noted in the program and the guidance, and also in our policies. We have a couple questions related to day-to-day administrative supports under the goods and services. Christy will be sharing additional information related to that new option for people self-directing. So please join us on Monday for that information. Question about the cap for transportation being $7,500. That is the cap for the DDA funding authorization. In terms of people self-directing, they can utilize their unallocated funds to support additional transportation as they need. There's a question here that says, will DDA remind providers when their waiver is due for renewal? I'm not sure if that's related to provider license and certification. So if you could share additional information, if that's the case, your regional office provider services staff can assist you with that. Question about transportation, does it include Metro access? Yes, there's a variety of opportunities, including Metro access. A couple people saying they're having some challenges with the links to the guide to services and easy to read. Happy to share that, let Donna know, and we can send that out in addition to it being in the PowerPoint. Nova, we have a couple questions about my LTSS and whether people self-directing will have access to LTSS. Can you give us a little update in terms of my LTSS?
Sure. Yeah. So just for clarification, people don't have access to LTSS Maryland. My LTSS, which is a different portal, but links up to LTSS Maryland, is for people to look at their services, provide, make updates to their information, and ultimately we'll be able to look at services delivered, provide access to their PCP to providers and other representatives. There are several parts to the rollout for my LTSS, but it will be available shortly. We're testing it right now to make sure it works for everyone and people can access it easily and understandably. And so once we get through more testing and creating some informational training for people, we'll be rolling that out. So that should be coming up in the next month or so. And then there will be additional enhancements as we kind of work through that and get feedback and to make it easier for people just to access their information and take more control of what their services are. So there will be more information to come.
Thanks, Nova. And that ability is for people enrolled in the DDA program. So it doesn't, regardless of service model, it'll be for traditional and self-direction. So all participants will be able to access that portal if they so choose. For the individual and family directed goods and services, the question about the limit of $5,000, is that for all items or per item? The threshold for a review by the regional office would be $5,000 per item. Then we get to the meaningful day ones. Couple LTSS questions. Couple questions about budget modifications and the use of DDA COVID Form 5. Christy will be reviewing that on Monday. She'll be providing updated information related to the updated budget modification as the COVID Form 5 will be discontinued after June 30th. DSAT, question about the DSAT tool is for service coordination or service coordinators, question mark. Nick, do you want to talk about, again, the DSAT tool and what its intent and use can be?
Yeah, the DSAT tool is called the Detailed Service Authorization Tool. And how the DSAT has been utilized was, it was a form that was completed by providers to outline the services that they were providing to a person in LTSS. That tool then helped communicate to the CCS what to authorize in the plan. If the tool is helpful for people that have already transitioned into LTSS, they can continue to use it, but it is not a requirement form. Additionally, all of the conversations or anything that form communicated can be communicated as in a team process and should be communicated via team process, because it's the person who decides what services and supports they want and makes that request through their person-centered plan to the applicable provider. And so there is an opportunity either during the pre-planning process, during the PCP process, to have a good team conversation about what the person needs, wants, what they're requesting, and how to authorize that in the PCP so that the provider can accept it.
Thanks, Nick. We also have a question about the cost detail updates. Robert, don't know if you're available to respond to this question, but they're asking when the cost detail tool will be updated to reflect the 24-25 numbers and rates. So we'll take that back and be providing some updates related to the updates for those that still need to use the cost detail tool to make sure that the updated rates are in there for the new fiscal year. We've gotten a couple of questions related to people who may be supported by REM and also in DDA programs and in terms of that nursing care plan. And so a couple things that I would say in general, and then Nick, if you want to add anything to it, it's really important to coordinate with the team and all services. So if people are being supported by multiple programs, you want to make sure that all the services are being considered and coordinated together and not done separately. People who are receiving REM may be getting skilled services. Some of them may be receiving home health aid type services. And so you want to look at that from that perspective. And for delegated services under our programs, that would need a nurse that would be developing that nursing care plan. So my key points would be the importance of coordinating if you're in multiple programs, looking at those nursing needs to make sure it's a coordinated effort. Nick, what would you like to add?
Yeah, I think you captured it. There's got to be good coordination. There's got to be good documentation in the plan as to what those services look like for the person, particularly from a DDA perspective. And I would encourage CCS to ensure that they are coordinating with other entities that are providing services as well, so that the PCP is a true reflection of what a person's day, month, year looks like in terms of support that they're receiving.
Thanks, Nick. Couple comments or questions about if the DSAT, the Detailed Service Authorization tool, will not be required. How do we request dedicated hours? Again, as Nick shared, really have that conversation with the team. It's not required if you're billing in LTSS, and really that conversation, that team approach really should be the way to be looking at it. And we shared information today about dedicated 1-to-1, 2-to-1, personal supports enhanced rate, and overnight supports in terms of tools that can be used. In addition, that the DDA can authorize those levels of support even in unique situations without a nursing care plan or behavior plan. So really go through that process, identify those assessed needs, and there's various documents and tools that could be used. Okay, a question for the service implementation plan, Nick. For the providers' service implementation plans, will there still be a requirement for one outcome per goal? LTSS will not allow us to repeat outcomes.
Yeah, so remember the SIP is something that's outside of LTSS. It's a document, it's its own kind of standalone document. So whatever the team decides are the outcomes, then if the outcome is related to a service you're providing the person, then you will work on identifying the goal for that and the service or the implementation plan to make sure that the person can meet that goal.
Thank you. We have a question about, can dietitian visits or access a client at daycare as they may receive 10 meals per week? Please note the DDA does not have home delivered meals in our programs. So if this is being provided under Community First Choice or another program, we would refer you to those program standards. Next question is, as of July 1st, what is the criteria for virtual supports? For example, per participant's choice, if they want 100% virtual support services, is that available? Please note, virtual supports was added to our waiver programs with our amendment number 3 some time ago. So they continue to be available even once the Appendix K flexibility ends. But please note, under the waiver programs, virtual supports cannot be provided 100%. That is noted in our waiver program. And we have some assurances with the federal government to ensure that we're supporting community integration with the community settings rule. We want to make sure we're ensuring that people are not isolated. So you want to have that conversation with the team about the appropriate services and supports, but they cannot be provided 100% virtually. Question related to self-direction for families that are required to now have a support broker. Is there guidance on what that looks like? Can a family hire a support broker but not utilize them? Christy will be sharing information related to support brokers and the new requirement that goes into effect related to individuals using family as staff, rep payees, and others that will now require a support broker. Question about ISS grants, whether they'll continue to be a source of funding. Suggest that you reach out directly to your regional office director to have that conversation. Okay, a couple of comments. Thanking for the presentation, learning something new. Cost detail tool, we talked about that. You have questions about additional information being requested for your PCP, please reach out to the regional office director and they can help you with that. Couple suggestions about maybe some wording. You could word language revisions. Thank you. We'll look at that. For virtual supports, do we have to provide 6 hours daily in order to bill when Appendix K ends? So we just talked about that. Virtual supports cannot be the only method. And so you want to provide a variety of in-person and virtual supports related to that. And as Nick has shared, if you're billing in PCIS, there is that minimum of 4 hours with documentation in the plan for why it would be less than 6. So refer back to that team process. Question related to a specific, I see Nick, you answered that one. Nova, question about day habilitation services. Are those services able to be provided on Saturdays and Sundays?
Yeah, so day habilitation services as with any of the meaningful day services, there's not a limit on when they can be provided. So they can be provided on Saturdays and Sundays within a 40-hour window, with the exception of ongoing job supports.
Great. Question related to people who are not with a provider where there is a nurse. Looks like it's under self-direction, having some challenges retaining a nurse to do clinical reviews, which is delaying processing a PCP. Can or does the DDA have a contract for clinical reviews of HRST to support self-direction? Nick, do you want to share your thoughts on that?
Yeah, we can certainly to have that conversation back with Adrian, who's our director of nursing, and also the regional office. If there are unique challenges that are present, we can have that conversation. So I would encourage you to reach out to your regional director, who can loop in the regional nurse, and also Adrian, who's our director of nursing.
Great. One comment related to some challenges finding behavior support vendors. Please reach out to your regional office and they can provide some support there. Okay. Question about, can transportation be also provided by ambulatory transportation providers, or is it only limited to family, Ubers, Lyft, etc.? Please note, if you need ambulatory transportation, that should be explored under the Medicaid state plan as non-medical emergency transportation services that are available to support people. A note that we noted the training as 5/23, but Monday is the 22nd. The self-directed webinar is on Monday, May 22nd. Just going through some of the ones that you've replied, Nick. Questions about the attachments? Yep, Donna can forward the attachment afterwards. Please reach out to her. She can do that. Question, with CPR first aid now being required in person as a 7-1, should staff members be obtaining in-person CPR first aid, or will the virtual CPR first aid be valid? Nick, do you want to address that, or you want me to?
Yeah, I can address it. So essentially, if you've had your CPR first aid and it was done virtually because that was the rule and the process in place, it doesn't need to be completed in person until it is up for renewal again.
Thanks. Question, whether a relative can be the support broker under their business name. A relative can be a support broker under their business name, but please note guidance and policies related to if your relative is a support broker, because that will impact whether other relatives can provide direct supports. Some questions about transportation for self-directed services that will refer to Christy. Question about getting a letter from the Eligibility Determination Division about Medicaid redetermination. Didn't get the forms. Do I need to wait for the forms or take action now? Great question. A number of letters went out to let people know that the redetermination process will be coming. And so you may have received an initial letter just letting you know that this process would be beginning. When you get the letter that asks you to submit documents and forms, you want to make sure you take action on that. In addition, you can create a MD Think account where you'll be able to add information and see your actual due date for that. If you have additional questions, please reach out to your coordinator of community services that can assist you, or the regional office. And I see that we're at 1:30. I want to thank everybody for joining us today as we share information about the waiver renewals. Again, we have a number of information and tools you can refer to, including the renewal service summary slide or summary chart, the dedicated web pages for the renewals. We've got the updated guidance that we shared today, including the PCP manual, the guide to services, the easy to understand guide to services, and the provider, the guidance for authorization and provider billing documentation. We appreciate your time and wish you well, and look forward to talking with you soon. Thank you.